A surgeon should have a good knowledge and thorough understanding of the surgical and operative anatomy and surgical physiology. This would help in the preoperative and postoperative care of the patient. One should elicit the past history of diabetes mellitus, hypertension, bronchial asthma and cardiac diseases, including any past surgeries and chronic medications. History suggestive of varicose veins, deep venous thrombosis, the children either delivered by LSCS or normal deliveries. This leads to an accurate diagnosis and holistic care, and one should adopt a team approach and also consult other services to optimize the patient. One should discuss with the patient the surgical options, their risks and benefits, and take a good written consent. Also bearing in mind to prepare blood and its products in the likely event that they are required. One should obtain all necessary labs, imaging, ECG, echo and indirect laryngoscopy if needed. Remember that the patient gets intubated. Advise them to stop smoking, to get a dental care if required, and give prophylactic antibiotics for any lung conditions. The hydration and nourishment of the patient, both micro and macronutrients, should be ensured, best by the oral route, alternatively by the feeding jejunostomy, and otherwise parenterally. Preoperatively, one should prepare the operating room and the instruments. Counseling must be offered if required, and preoperatively the patient needs to have a good sleep and anxiolytics may be prescribed. Antibiotic prophylaxis is not a substitute for poor surgical technique. Site marking helps to prevent confusion. The patient should also be nil per oral. Just before the induction of anesthesia, all the operating room staff stop and take a time out and confirm the name and diagnosis of the patient, and also discuss the operative steps with the readiness of the anesthesia equipment. Post-operatively, one should take a note to positioning the patient so that there is no risk of aspiration, and this is especially true in head and neck surgeries. Adequate analgesia as required, antibiotics if they need to be continued, and adequate hydration in the form of not only fluids but even electrolytes. One can decide as soon as possible to start the feeding or offer nutrition in another form. One should take care about the DVT prophylaxis.